Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. It's Friday, September 20th. I'm Elizabeth Arkalian. Coming up, as fall begins this weekend, health experts are encouraging people to get their flu and COVID-19 vaccinations.
It's still a virus that's mutating, and the best way to protect yourself is with the new vaccine.
My conversation with a Fresno-based pharmacist coming up in just a few minutes. But first, today's headlines. A member of the prominent Assemi family in Fresno has issued a public statement over recent news about their financial shortcomings. Darius Assemi said in a post to GV Wire, which Assemi publishes, that current financial troubles in its agriculture businesses come from a lack of agreement over financial restructuring with lenders. Assemi said he's, quote, hopeful a resolution can be achieved. According to court records, the Assemis have defaulted on more than $700 million in loans this year and are at risk of not meeting payroll for employees. With the November election less than 2 months away, a new statewide survey from the Public Policy Institute of California is tracking the mood of voters right now. KVPR's Esther Quintanilla reports.
The survey found most Californians are satisfied with their choice for candidates in the upcoming election. Vice President Kamala Harris and running mate Tim Walz are currently leading former President Donald Trump and J.D. Vance by more than 30 points statewide. However, there are some negative feelings about the future. Nearly half of those surveyed think the state and the country are headed in the wrong direction and are expecting financial hardships over the next year. California voters are also divided on statewide propositions, namely on Prop 5, which would allow local bonds for affordable housing and public infrastructure, and Prop 32, which would raise the minimum wage. For KVPR News, I'm Esther Quintanilla.
A Fresno agency that helps welcome refugees celebrated a new welcome center this week. The Fresno Interdenominational Refugee Ministries, also known as FIRM, says the new center will offer support for newly arrived refugees and immigrants in the Central Valley. The staff will offer help with navigating healthcare services, community resources, and school enrollment. Since 2022, FIRM has welcomed 350 immigrants and refugees into the region. It's about to get harder for California cities to refuse building new affordable housing. Cap Radio's Megan Myskowski reports that Governor Gavin Newsom signed dozens of new housing bills into law on Thursday, including several to encourage more construction, even when local governments drag their feet.
Many of the 32 bills signed not only make it easier to build more affordable housing by loosening zoning and planning laws, they also open the door to state officials coming down harder on local governments that ignore requirements to build. Newsom called out some of those localities, like Huntington Beach, during a bill signing.
We continue to struggle with accountability. We continue to struggle with transparency.
One new law will enable the Attorney General to seek higher penalties against local governments in these cases. Another will allow the state to step in and designate sites for affordable housing and streamline applications. Californians might also see more interim housing, like small trailers, going up. Democratic Senator Josh Becker from Menlo Park sponsored one of the signed bills that streamlines zoning and hurdles for cities to put in relocatable, non-congregate housing.
When they have a fixed place to live, then they can actually get services.
The bill also makes more money available for these projects. A couple more new laws aim to bolster tribal housing by creating a specific funding program for it and giving the state's tribal housing authority more autonomy and support. In Sacramento, I'm Megan Myskowski.
KVPR is in the midst of our fall membership campaign. We're public media, and that means we rely on listeners like you to fund everything we do, from podcasts like this one to news on our website and radio broadcasts on 89.3 in Fresno and 89.1 in Bakersfield. Support local journalism in your community with a donation now. Go to kvpr.org/donate to become a member today.
And now to our main story. As fall officially kicks off this Sunday with cooler temperatures on the way, health officials in Fresno County and across the state are encouraging people to vaccinate for COVID-19. Dr. Bobby Dhaliwal is a CVS pharmacist who helps oversee their Fresno area locations. He says the updated vaccine will help your body fight against the latest COVID-19 variants.
So COVID-19 is a virus, right? So a virus causes that disease. And what we know with viruses, same thing with the flu virus, they mutate and the strains have different variants. So just like the flu every year, it's important to make sure that we're protecting our patients and communities, because what happens is they lose some of that immunity and it declines over time from the previous vaccine. So what this new vaccine that just was released recently has the most recent variants in it to protect against the new virus.
Yeah, I think a lot of people are kind of fatigued on the issue of COVID, to be honest, especially considering there are other illnesses that can peak in the winter, colds, flus, RSV now as well. So as a pharmacist, what difference is getting this vaccine going to make? What would you tell people?
What I tell my loved ones and my patients and for our communities is you want to stay protected, right? Definitely some fatigue. We went through a lot of, it was just a different era, right, with COVID. And there was a lot of information out there. The good news is we've kind of adjusted to it and we've kind of gotten used to it, but it's still a virus that's mutating. And the best way to protect yourself is with the new vaccine.
So let's talk about the rollout. Where can people get these vaccines? Can they go to their doctor's office? Can they go to a pharmacy? What's it going to look like? And is it available now already?
Yes, no, great question. So again, I work with CVS and we have it at all our locations. It's readily accessible. Or you can just walk up to your any pharmacy, right? And walk up and talk to your pharmacist. Pharmacists usually are the most accessible healthcare providers right there at the counter, and talk to them about it and see which one is right for you, which dose, which vaccine, and more importantly, not just COVID, right? We want to stay up to date on all our vaccines. Our pharmacists at CVS do a great job of recognizing immunization gaps and recommending the vaccines that may be due for your protection for you, your family, and of course our entire community.
And what does the cost look like? Is it still free?
So that's a great question, right? So most insurance providers do cover it. In a case it's not covered or you don't have a third party, at that time, what we recommend is reach out to your local or state government agencies for free clinics. They're definitely going around. You kind of usually find that on your local city or state website. But if for some reason you did want to pay cash for it, the cost is about $200. But again, I would encourage you to make sure we, correctly bill your insurance and make sure we go alleviate all other chances so you can not pay for it.
Are children and seniors still the most susceptible for getting COVID-19?
It all varies, right? There's multiple pre-existing conditions, but with anything, right? Children, seniors are usually more vulnerable along with other patients that have other chronic conditions. So we want to make sure they are protected.
And it's now been 4 years of these winter seasons where COVID's been a factor, even though generally speaking, it seems to be less severe than it was obviously in 2020. What have we learned so far in your opinion?
I think we've learned it's like any other virus, right? It's going to change. It's going to mutate. Your bodies will build immunity, but it still can be very serious. It can still cause serious complications, especially the people you mentioned, right? The children, elderly, or patients with multiple chronic conditions. And we want to make sure everybody stays protected.
Can vaccines help with symptoms of long COVID?
Yeah, long COVID is something that's been discussed a little bit more recently, right? And it's definitely a concern. And the COVID vaccine does offer protection against that. And it's important to know that, right? It minimizes some of those symptoms. So we'll definitely recommend, if you're suffering from it or prevent it or minimize it in the future, you definitely get vaccinated.
CVS Pharmacist Dr. Bobby Dhaliwal. You can find the latest information and recommendations on the COVID-19 virus at covid19.ca.gov. And that's today's show. Thank you for listening. If you have feedback on today's episode or a story idea, you can email us at podcast@kvpr.org. This week is just our second week of production here at Central Valley Daily. If you like what you've been hearing, help us build some momentum by leaving a 5-star rating in your podcast app. Or even better, share the podcast with a friend. We really appreciate it. Today's episode was produced by Jonathan Linden and KVPR with support from the Central Valley Journalism Collaborative. I'm Elizabeth Arkalian. Find the latest local news anytime at kvpr.org.